Pete, who's running the session tonight, is another one of our committee members, and he's the owner-director of Flagship Training. So, lovely to see you all here. I think, Pete, I better hand over to you.
Oh, thank you, Katie. It's such a wonderful introduction as well. Good evening, everyone. My name is Pete Rushmer. My business is Flagship Training. How are we all doing? All right? So I wanted to speak to you today about mental health. It's Mental Health Awareness Week. As you are aware, a little bit of a disclaimer from me. I'm sat outside at the minute, and people say not to work with children and animals. Well, there are children and animals present. So if you hear barking or if you hear the ice cream van going off or anything like that, that may actually be possible. So yeah, just a bit of a disclaimer from me, but I'll do my absolute best to keep it on point for you. With it being Mental Health Awareness Week, I was due to speak to you guys in September around one of my passions, which is men's mental health. It's something that's really, really important to me and part of my business, where we do a lot of mental health training with blue collar workers and people in that sector, and a lot of work with men's mental health particularly. And I wanted to prepare something for you that we could all get together and we could raise awareness in the community, support each other, because ultimately we're all going to be facing some real challenges at the moment, some real challenges. Some people are going to be feeling quite isolated, and I really wanted to be able to do a great session with the tools that are readily available, free to access, and that we could put something together that's really good for you guys. As Katie said, we sat down last month and had a bit of a conversation around the different sessions that we could put on. So this one's a bit of a temperature check for everyone, a bit of a forum for everyone to have some input and for us to have some great conversation. And then later on this week on Wednesday, Heather Knapp from 𝐂𝐚𝐮𝐬𝐞𝐬 Counselling Consultancy, she's going to be talking about strategy and training. You know, as Flagship, we do mental health training, but I thought it'd be unfair for me to focus totally on that. So Heather's going to be talking about that. And then on Friday, like Katie said, we're going to be doing a coffee and a catch up. And then we've got Amy Polly for some mindfulness. She's a mental health speaker and works for the fire service. That's going to be super exciting too. So with mental health, one of the things that I was reflecting on is, with a real challenge that we face, is that there's so much information out there. It's just incredible really how much there is to try and comprehend or to deal with, and there's lots and lots of people out there making lots of different sessions. So what I wanted to do was make sure that we did a session which was really around our fantastic community and around the challenges that you guys are facing. So you know, there's dozens of training courses out there, and some are good and some are not so good and what have you, but you know, I created this survey 2 weeks ago to just sort of see what is happening in the community and see what is happening out there, because as we keep hearing on the news, we're living in an unprecedented time. So the survey I created, and we had 30 respondents from the community, whether they came through LinkedIn or through Facebook, people that have been present at our networking and people who haven't. So if you're one of those people, thank you very much. We really appreciate you taking the time to have completed that and give us our feedback. You know, there's no other networking that can connect you in the same way as this platform. So really big up to Katie and Nikki and Eve for being able to create such a good community. So we really, really appreciate that. And, you know, it's fantastic that we're able to do this. So by running the session, we can give you, you know, the opportunity to connect with other members too. I wanted to make you aware of, there's a member called Gary Beckwith from 𝐂𝐨𝐫𝐤𝐿. He's got a surveying platform. So to do this survey, I used a free platform called Google Forms. However, he has offered his fantastic survey software free of charge to HR Connect members. If anyone wants to make a note of his name, he's certainly worth speaking to. It's a great opportunity for you guys to utilise the systems that are out there to be able to make sure that you can have impact in your workplace. So we realised that, you know, we needed support for the community, and you know, we were able to make questions anonymous, and you know, potentially you may not want to ask. So all of the feedback that we've taken, there's no names involved, and we're able to get a really good understanding of where people are at currently. It's very hard to judge what will work online when you move it online. So obviously your patience during this session is really appreciated. I wanted to show you how as leaders in your businesses, we can use free tools to temperature check, like I said. And the issue often isn't that we don't have the answers, but it's often the case of, are we asking the right questions? So we wanted to know about how businesses are embracing mental health. So with regards to that, we wanted to, the first question we asked was, have you attended any online sessions regarding mental health in the workplace? To which we had 2/3 of respondents saying yes, they had. Oh, sorry, no, they hadn't. And some saying they had. The feedback on those, the sessions they'd attended, was around how are businesses embracing mental health more proactively since lockdown, being able to give themselves time to breathe. They were also looking at how others support in their organisations, so getting a better understanding from a community point of view how that can help, how staff can also help themselves. Someone responded saying they're a mental health first aid instructor, hearing different organisations' approaches, and a lot about resilience. We had several respondents saying they'd been on resilience sessions, and any new ways of how to engage with their employees and keep topic a present talking piece. So hopefully I'm demonstrating a good solution for that by doing a feedback with people in your teams. And also someone did point out the number of people who do mental health sessions with little or no qualification, crossing the line from personal development into medical mental health care, which is quite an interesting point from one of our members, who's obviously keen to ensure that we do make sure that we are approaching mental health training in the right way. And it is important that we don't cross that line where we haven't got the level of qualifications to be able to deliver that. So yeah, we are still on the first slide, Zoe. Absolutely. Sorry, I keep going on. I just wanted to be able to set the scene. Nikki, are we able to have the second slide, please? Brilliant, thank you very much. So the second question we had, do you think COVID-19 will have an impact on your approach to mental health in the workplace? And interestingly, 90% of respondents, or almost 90% of respondents, said yes, they felt that there was going to be an impact to mental health in their workplaces. And the remaining 10% said they weren't actually sure. So I found that really, really interesting. And the next question was, if so, in what way do you think your workplace will be affected? So we had some really, really interesting responses on this part of the survey. They said they anticipated higher staff absence. People were already seeing a rise in anxiety and depression too, which I thought was quite topical and interesting too. So I'll form part of my feedback on that as well. People were more conscious of how anxious people are. People were taking mental health more seriously in their workplace as well. That they'd seen a change in routine. There was more absence related, delayed stress. Some people were concerned about PTSD, post-traumatic stress disorder. So that's something I'll talk about shortly. I think I'll be more aware of my surrounding and those that I work with. People are reporting that there's high levels of anxiety and stress due to COVID-19. Several people said that. Some other interesting comments that I wanted to pick out were, with so many people on furlough and isolation, there's the opportunity for poor mental health to surface, especially if people aren't taking care of themselves. This is an extremely complex question, and there will be a myriad of different issues, from bereavements in a family to anger about government strategy, financial relationship breakdowns, uncertainty over job stability, childcare issues. The person also went on to say that they're a one-person business. If they have no training bookings, they have no business, so they're then struggling financially too. There was more comments around generalised anxiety and less stigma around anxiety. So actually the benefit of us having this session now and Mental Health Awareness Week now is that actually we are really working to be able to reduce stigma, which is fantastic. Mental health has become more important to us as we feel there will be a knock-on effect on people's mental health after lockdown. I hope that in response we'll be able to create a more mindful workplace, that there will be greater focus on support available and the way in which we managers and co-workers are more self-aware, aware of others, and practice empathy and compassion as part of our everyday lives. So a lot of people talking about redundancy, fear of redundancy, and health and safety concerns. So one of the key things that I wanted to take away from today was actually, before we deal with any of the mental health challenges as people are coming back to work, we really, really need to focus on our health and safety strategy and engage our health and safety managers too. Our session in June that I'm working on at the moment is to bring Steve Smith from Sphere, who's a health and safety specialist. He's going to come and do an online session for us around health and safety and being able to adapt for COVID-19. So hopefully that'll be a great session for people to join as well. That's going to be really, really important. You know, we're hearing so many people say there's challenges with anxiety and what have you, that actually health and safety is such a practical part of us being able to deal with that too. So going on with some more of these fantastic comments that we got, the feedback, I think we'll be faced with very anxious employees when it comes to their safety at work and the future of our organisation and the safety of their roles. So there's a couple of things there. So there's the health and safety element that people are concerned about, but there's also the safety of them financially and the stability of their roles that are going to be causing a concern following COVID. A large Peterborough employer was actually named, I'll take the name out, are re-beginning their mental health and wellness journey, having picked up where they left off a year or so ago. Given the effects we have seen and or heard about, not only from our own workforce, but also on how isolation has affected mental health, they have to encourage people to keep talking. There's so much traction to bring this back to the forefront and bring this more into focus with not only all of our employees, but back in and buy-in from the senior leadership too, to enable us to do more in this space to show that this is something we really care about and support. So one of the things that I was going to ask you guys to do in the breakout room shortly, when we have a breakout session, is actually discuss what's the uptake like amongst your senior leadership teams as well. It's a really, really important part of making sure that mental health and the message gets out there. A them and us divide was raised between those that are on furlough and those that are not. Uncertainty regarding the future, creating anxiety regarding future job security, again, was mentioned. Katie, would it be possible to have the next slide, please? Thank you. So we had a lot of respondents talking about anxiety. So I wanted to go into that in a little bit more depth and explore that. So what is anxiety and why are colleagues likely to have elevated anxiety right now, which is a great opportunity for us following this feedback. So anxiety or fear and worry can happen to anyone from time to time. It's not unusual to experience anxiety before a big event or an important decision, but chronic anxiety can be debilitating and lead to irrational thoughts and fears that interfere with your daily life. Physical symptoms and behavioural changes can be caused by generalised anxiety disorder, and there's different types of anxiety that I'll talk about in a moment. Feeling fatigued, muscle tension, racing heart, grinding teeth, and emotional symptoms include restlessness, irritability, dread and panic. They all constitute what could be quite a challenging workforce and challenging situation for us at work. Different types of anxiety. Generalised anxiety disorder is when people feel anxious for a sustained period of time, which they will have done during lockdown. So that's going to be a real concern for people going back to work. Also, something that I'm seeing increasingly when I speak to people is around social anxiety. So a person has an intense fear of being criticised, embarrassed or humiliated and going out and speaking in public, etc. So people have got used to being at home and working at home. You know, I've seen this firsthand with my wife, where she's had to go back to work following having children, and she spent a sustained period of time away from work. She just hasn't got used to that social interaction. So that's going to be a real challenge for us to deal with and cope with too. Other types of anxiety disorders include phobias and panic attacks and OCD. So OCD could be something to keep an eye out on. Obviously with such a situation of cleanliness and hand cleaning and constant cleaning down of surfaces as well. Obviously it's all part of our process in making sure that we stay safe from the pandemic, but at the same time, we just need to be conscious of the impact that that could have on our colleagues as well. And finally, someone had mentioned earlier in their feedback around PTSD, but actually that could be a genuine problem. You know, people have suffered traumatic events, certainly for a sustained period of time as well. They may have had family that have been unwell. They may have had financial challenges as well too. So there's lots of things that we can do to help manage anxiety. You know, one of the things that I put out on social media recently was actually recognizing anxiety, recognizing that we have a problem and being able to deal with that. Excuse me. You know, doing things that we can have control over, and creating routine as well, which hopefully people will get by going back into work. There's various breathing exercises, massage too, CBT, talking therapies. There's loads and loads of good stuff that we can do, but actually what can we do as employers and with team members and people that we work with to be able to support them in that journey? And that is something that in the breakout session I'd like us to discuss shortly. Katie, is it possible to go on to the next slide if possible, please? Thank you very much. I'm just going to take a quick swig of water. I hope everyone's finding all this data interesting. I'm quite a data-driven person, so hopefully it's quite relevant to everyone. Are we finding that? Is it interesting? Good, excellent. Okay, so this slide was, is there anything in particular, let me just work this out. So is there anything in particular you would like HR Connect to cover in our upcoming mental health week sessions? So there's actually so much feedback. Obviously this was a forum session for us to actually understand what the current situation is. And actually there's so much information that we could potentially talk about. It might be worth us having some more feedback to maybe do some sessions after Mental Health Awareness Week, you know, because really in an hour, how much time can we touch on? And actually this is so prevalent. So interestingly, nearly a quarter of respondents were interested in tips on managing mindfulness. Well, that's a fantastic opportunity because obviously we've got Amy Polly coming to speak to us on Friday about that. Over 50% ways to encourage well-being in your colleagues. So if you could just please make a note of that. Like I say, in a moment we're going to go into a breakout session, and it'd be really good to hear about great examples that you've come across, or suggestions that you may have for others as well. 37% each, so maintaining well-being during COVID-19 and how to keep yourself balanced when under pressure. So these are much more individual to us. Obviously we're going to be facing pressures too, as well as worrying about people around us. Discussing mental health in your workplace. So it'd be good to maybe have a bit of a conversation around how we can do that as well. I'm going to follow up each of these points actually into the social media group. So please stay tuned on LinkedIn and on Facebook, because I'm going to be putting some material out there and we can create more conversation there too. Interestingly, the really big ones were strategies for supporting staff members. Nearly 60% of people were interested in strategies for that, and coping with the additional stress that's been caused by COVID-19. So again, we're talking about stress there. There's clearly an increased challenge amongst all of us as professionals too. How COVID-19 will affect people emotionally. Again, nearly 50% of respondents were interested to hear about that. And then workplace mental health policies, around a third, as well as workplace mental health training and employee assistance programs, nearly a quarter. I think a lot of the bigger organisations have got employee assistance programs in place. With regards to mental health training, well, what's available? There's lots and lots of available training that's out there. We do a workplace mental health training, which is, we can do a half day, a 1 day or a 2 day, and there's also online mental health awareness courses that are available. Mental health first aid is another solution. So it really does depend on your business and what people are willing to invest to support their people. However, there are other ways that we can do that too. Thank you very much. I'm being bought coffee. Brilliant. So coping with additional stress as well. So Katie, could I just have the next slide, please? Brilliant. Thank you very much. And here we had some free text questions, which I just want us to reflect on a little bit. So is there a question or questions regarding COVID-19 or workplace mental health you would like us to cover in our sessions? So members of the community were interested in genuine examples of good workplace wellbeing strategies that can be shared. Lots of companies talk the talk, but the reality on the floor is very different. I can tell you firsthand that that is a real challenge for a lot of businesses, certainly in the businesses that I come across in the course of our work, and also companies that I've had a close relationship with as well, that there's a certain strategy set out, but actually what's happening on the shop floor. So hopefully I've put into practice a really great solution that people could take away. Just using a simple free format like Google Forms, I've been able to take a temperature check, certainly of our community, the HR Connect community, and actually you could use similar tools with your people. Many of our staff are asking about returning to work and if they can work from home permanently. How do we handle this? I think that's probably a question for Nikki, which we'll come to in a minute. I'm sure Nikki's smiling at that. What would be your engagement tools for a company who has over 500 employees, and how do you touch everyone and give them time and they've not got access to computers? So that's a really, really big challenge, and something that I think is probably worth us having more of a conversation about too shortly. How to juggle being a carer as well as working full time. That's a challenge that many of us are going to face. Katie, is it okay to have the next slide as well, please? Thank you. Someone's interested in ways others are looking to promote workplace mental health and mindfulness when co-workers return to work following the current lockdown. The connection between menopause and poor mental health has also been suggested. How do we best connect with those who are perhaps reluctant to reach out for help or support? So this is my favourite area with our training. I do a lot with driver CPC training, so HGV drivers, and a lot of work with real blue collar workers, and it's one of the things that I love engaging with. I love nothing more than, there's no such thing as mental health, mate. You can't teach me anything. And that's always a really good attitude for us to start with, and then for us to be able to work with too. So, but there's lots of ways that we can connect with people, and how to provide support to both remote workers and those who are continuing to work on the front line with care workers, etc. too. So what I'm going to do is I'm going to sort out some breakout rooms for you guys to go and have some conversations. If you've got a notepad with you, please could you just make a note. We're interested to know, what tools and strategies do you use to engage your people with discussing and supporting their mental health? I would also ask, have you had any challenges with buy-in from senior management? How are you supporting people working from home? And how do you measure impact at shop floor level in your businesses or businesses that you've dealt with? And I'm just going to put that into a breakout session now for you all. So everyone got notes there, and that okay? Everyone ready to have a bit of a conversation? Got fed up of listening to me for too long. So I'm just...
What was it, Pete? I'm just going to ask you, what was the third question? I was scribbling away.
Oh, apologies, too quick. I'm sorry. Right, okay. So the first question, just to recap, what tools and strategies do you use to engage your people with discussing and supporting their mental health? How do you support people working from home? And how do you measure reality and impact at shop floor level? Was the third one. And I'm just going to put you into breakout sessions now. Hopefully you guys have got those ready. What I'm going to do is set Nikki, Katie and Eve, the other committee members, are going to just sort of chair that breakout room, and hopefully maybe there'll be spokespeople who are willing to feed back to the rest of the room, but it'd be really good to get a bit of an overview of what everyone's thinking, feedback, and then bring it back into the room and we'll have some conversation. So I'm just going to allocate some breakout rooms now. So give me a couple of seconds.
Remember the good old days when we used to just be able to turn our chairs around and
exactly. I must say it's the strangest thing trying to facilitate a session like this. It's the first time I've done it, so hopefully it's going okay. Right. So Katie, I'm going to move you to breakout room 3. Cool. Thanks, Jay Mitchell. I appreciate it. I'm doing a fab job. Thank you very much. Right, so let's open these rooms and let's assign people. So assign to 1, assign to 2.
Lovely.
Hopefully,
so you should see soon on your screen that you're invited to join a breakout room. If you just click the join button, and then we'll see what happens, hey?
Thank you very much. Just assigning people now.